Welcome to Chapter 1.2 of Pharmaceutical and Medicinal Chemistry. This chapter is on pharmacodynamics and pharmacokinetics. The instructor for this chapter is Dr. P. Aruna Devi, Reader in Chemistry and PG Director, St. Joseph's College for Women, Autonomous, Vishakhapatnam. The later part of the chapter, it is on pharmacokinetics. Pharmacokinetics is the study of what the body does to the drug. So far, we have seen what the drugs do to the body. For example, is it an agonist drug? Or is it an antagonist drug? Or is it a neurotransmitter? All that we have seen under pharmacodynamics. Now let us see what the body does to the drug. That study is called as pharmacokinetics. It is the study of fate of chemicals entering the body in order to know the drug concentration at different intervals of time after drug administration. Drug administration means taking the drug into the body. After drug administration, what is the concentration of the drug at various intervals of time? In order to know that, mathematical models are used to know the absorption, distribution, metabolism, and excretion of drugs. It is the study of concentration, time, and intensity of drug effect. ADME, first part is absorption. Absorption refers to the process of entry of the drug into the circulatory system. Whatever may be the mode or whatever may be the route through which the drug is administered to the body, it has to enter the circulatory system. We all know that circulatory system refers to arteries, veins, heart, and the flow of blood. So the drug has to enter the circulatory system. How the drug is entering the circulatory system is what comes under absorption. We know that intravenous drugs, that means drugs that are introduced into the body through intravenous injection, that means they give directly to the blood vessel, they enter the circulatory system instantaneously. That means as soon as the moment the needle is inserted into the blood vessel and slightly the drug is inserted, that moment itself the drug will start its action. So intravenous drugs will have instant entry into the circulatory system. Not only that, they have 100% bioavailability. That means the concentration of the drug is available at the target site 100%. In other forms of drug administration, like you can take a drug through the mouth, or you can have an injection to the muscle, or you can put it as an ointment, there are other forms of drug administration. In these forms, always absorption involves membrane crossing. That means the popular route is through the mouth. So when you swallow a drug, it will go to the gastrointestinal tract. From the gastrointestinal tract, it goes to the portal circulation. And portal circulation means the blood vessel that carries the absorbed drug to the liver, or the absorbed food to the liver. So the oral drugs, they enter the gastrointestinal tract. From there, they go for portal circulation route, and through the portal circulation, they reach the liver. In the liver, from the liver, they go to systemic circulation. Systemic circulation refers to the circulatory system. Circulatory system means from the liver, the blood vessel will carry blood to different parts of the body. So that is called systemic circulation. Through systemic circulation, they reach the target site. So oral drugs have a longer route: gastrointestinal tract, portal circulation. That means from the tract, they go to the portal circulation, hepatoportal vein. From there, they go to the liver. Now the liver, is the head of the family. It will distribute the particular drug through the circulatory system to different parts of the body, and finally the drug reaches the target site. Intestinal absorption, that means absorption of the drug in the intestine, is controlled by several factors. What are the factors? The factors which affect absorption of a drug are time of stay of the drug in the intestinal tract, how long it is staying, then surface area of absorption point. If there is large surface area, then there is scope for more absorption. If the surface area is narrow, then there will be lesser absorption. Then also it is controlled by pH of abdominal fluids. For example, if the pH of the abdominal fluid is very low, that is acidic pH, some drugs, if the drug is polar or if the drug has some affinity to acid, then it may not leave the intestinal tract easily to go into the blood. Or it is also controlled by blood flow in portal circulation, how much blood is flowing in the portal circulation. Efflux and influx transporters in the intestinal wall. Efflux transporters, they push back the drug into the intestinal lumen. Influx transporters transport the drug through the intestinal wall to the blood vessel. So the absorption is also controlled by efflux and influx transporter. And most importantly, the first pass effect. Liver has a function, or liver has a metabolism, or it performs the function of metabolism, during which the concentration of the drug may be reduced. That effect is what is called as first pass effect. While liver does several functions, while performing its duties, it can also perform one of the unwanted or not so much required function, which is also it will act upon the drug and convert it into some other product or some other metabolite. So this effect of reducing the concentration of the drug before it reaches the target site. See, it has not even entered the systemic circulation. So even before the drug has entered the systemic circulation, if its concentration is reduced, that effect is called as the first pass effect. So all these factors, time of stay, surface area, pH of abdominal fluids, rate of intestinal metabolism, blood flow, efflux, influx, and first pass effect, all these factors control rate of absorption of the drug into the portal circulation. We can see here different modes of absorption: active, passive, and facilitated. Outside concentration is more, inside concentration is less, automatically ions will flow. Or it is through a channel, passive transport. If there is a channel, through the channel it can be transported. Or if there is a carrier protein, the carrier protein can carry the particular molecule. Or it can also be energy. Sometimes, when it is against concentration gradient, or when the transport has to be performed against potential gradient, then energy is used. ATP molecules are consumed, then the particular molecule is transported. So these are the different modes of absorption: active, passive, facilitated, and also concentration gradient. Distribution. After the drug has traveled to the liver, it will enter the circulatory system. It is called a systemic circulation. Distribution will refer to how the drug is spread throughout the body. From intravascular space. Intravascular space means space inside the blood vessel. So from intravascular space, the drug will diffuse to the extravascular space. Extravascular space means outside the blood vessel. From there it will reach the target site, and there it will produce its action by binding to the specific receptors. Now, the distribution of a drug is expressed in terms of volume distribution. Volume distribution is the term used. Higher the volume distribution, greater is the amount of drug that is distributed. Now, volume distribution of the drug is controlled by two factors. One is biochemical properties of the drug, and the other one is the polarizer, the host physiology. One is biochemical properties of the drug involving how polarizable the molecules are, what is the size of the molecules, what is their binding ability. So all these factors will decide on the volume distribution. The other type of factors pertain to the host physiology: how much water is there, what is the hydration status, what is the protein concentration. There is a problem with protein concentration in blood. If the particular drug is a protein binding drug, it prefers to bind to a protein, then it is very difficult for the drug to travel from inside the blood vessel to outside. Large charged and protein bound drug molecules will have low volume distribution. That means if the drug molecule is large, or if it is carrying some charge, positive charge or negative charge, or it is bound to the protein. We know blood is having hemoglobin, where it is globular part is a protein, hemoglobin, the globular part is a protein. If this particular drug molecule has some affinity to get bound to a protein, then it will have low volume distribution, because it will not diffuse out from the blood vessel to outside extravascular space. Okay, we can see that intracellular fluids will have highest volume distribution. Once the drug is released out, 64% is likely to go into the cell, intracellular. And interstitial fluid means the fluid that is present in between cells and outside blood vessel. It is not part of blood vessel, outside blood vessel and outside cells. That fluid is called as interstitial fluid. It will be 25%. You can see this particular 8% plasma is not at all available. Plasma bound drug is plasma bound only. It cannot reach the target site and perform the function. So this is how the drug distribution is this generalized drug distribution. Of course, specifically it will vary from individual to individual as well as from drug to drug. Metabolism. We have seen what is absorption, we have seen what is distribution. Then we move on to the next topic, or the next part in the route. We said what the body does to the drug. So if the body absorbed, the body distributed. Now what is the body doing to the drug? It metabolizes. We know very well that liver is the king, it is the king of metabolism. So it is processing of the drug by the host. The drug is there in the body for some time, it is acting near the target site, but after some time, liver will start metabolizing it. So the processing by the host is what is called as metabolism. In this metabolism, it can also be conversion of an inactive prodrug into active drug metabolite. That is also metabolism, but mostly metabolism will refer to conversion of the drug into hydrophilic products for renal clearance. We know that kidneys are the ones that will eliminate the unwanted waste through the urine. So the liver will metabolize the drug into hydrophilic products through phase 1 and phase 2 reactions, such that even if the drug is originally some hydrophobic molecule, through this metabolic oxidative processes, oxidation will take place. Because of the oxidation, the molecule will become more polar. Because of its polarity, it will become hydrophilic, and urine, your water is there in the body, kidneys will collect that water. Through that water, because this the drug molecule, the metabolic product of drug is now hydrophilic, it will dissolve in that water and it is lost through the urine. So metabolism practically refers to how the drug molecules are converted into water soluble components, or the components that can be lost through the fecal matter. We can see finally excretion. Excretion will refer to elimination of the drug from the body. It is the irreversible loss of a drug or a drug metabolite from the body. Now, who are the eliminators? The kidneys. They through the urine they will eliminate, or the biliary tract in the form of stools, or the minor routes are sweat, tears, saliva, and breath. But major loss is through kidneys, and the second one is through the stool. We can see the major kidney is liver is the site for metabolism, and kidney is for filtration, secretion, sometimes reabsorption, and again filtration and loss in the form of urine. The minor routes are lungs through exhalation. Suppose the metabolic product is a gas, it will be lost through the lungs or through saliva, tears, milk of mother, hair, skin, etc. They are the minor routes of excretion. We can see the ADME process here, drug administration through the oral route, then only it will have to pass the stage of absorption. And if it is intravenous, it is directly distribution only. So if the intravenous drug administration is there, it need not pass the phase of absorption. Through absorption in the gastrointestinal tract, then it will go for distribution, and then it will go to metabolism, liver. In the liver, phase 1 and phase 2 metabolism, biliary excretion in the form of stools, renal excretion in the form of urine, and other minor forms of excretion. So finally we have seen that in the pharmacokinetics, what the body does to the drug is it will absorb, it will distribute, it will metabolize, and finally excrete it from the body. In a nutshell, we have seen that in the pharmacodynamics and pharmacokinetics chapter, that pharmacodynamics is the study of what the drug does to the body, how the drugs can behave as agonists or antagonists, and agonists will mimic the natural messenger and perform its functions, whereas antagonists block or restrict the natural messenger functions by competing with it for the receptor sites. We have also seen that neurotransmitter drugs can only modulate the effect of a natural neurotransmitter. They cannot alter the effect, they can only modulate the intensity of the effect. In the later part of the chapter on pharmacokinetics, we have seen that pharmacokinetics is the study of what the body does to the drug. It involves the study of absorption, distribution, metabolism, and excretion of drugs. Absorption refers to the entry of the drug into the circulatory system. Intravenous administered drugs will have 100% absorption, but other routes will suffer from first pass effect and other gastrointestinal factors. We have seen that distribution level is indicated by volume distribution. It refers to the journey from intravascular space to the target site, and distribution of the drug is controlled by drug properties as well as host physiology. We have seen that metabolism pertains to processing of the drug by the liver, in which process sometimes a prodrug can be converted into an active drug, and most of the times drug is converted into hydrophilic metabolites through oxidation. We have also seen that excretion is the irreversible loss of the metabolites of drug molecules through urine, stool, and other minor forms.